Okay, let's talk about Medicare. It can feel like trying to solve a giant, complicated puzzle, right? Well, don't worry, we're going to turn on the lights. So whether you're getting close to 65 or you're just trying to figure out the system, this is your quick guide to making it all make sense.
To get a sense of just how big this is, look at this number. Over 65 million Americans. Wow, that's more than the entire population of the United Kingdom. So this isn't just some government program. For millions, it's an absolute lifeline. And it's the single biggest payer in the entire U.S. healthcare system.
So, how are we going to tackle this beast? Well, we've broken it down. Think of this as our roadmap. We'll start with the basics, get into the core parts A and B, then hit the first big choice you have to make. Look at the two different paths you can take, and finally, cover the deadlines you absolutely need to know.
Okay, first things first, let's get the number one point of confusion out of the way because it gets everybody. Medicare is not Medicaid. They sound similar, but they're totally different. Medicare is a federal program that's mostly based on your age. Medicaid is a joint federal and state program, and that one's based on your income.
All right, let's dive in at the very beginning. The foundation for this whole system is something called Original Medicare. This is the government-run program, and it's the starting point for pretty much everyone. It's built on two main pieces.
The first piece of that foundation is Part A. The easiest way to remember it? Think of Part A as your hospital insurance. It's for the big stuff, the major health events that mean you need to be admitted to a facility for care.
So, what does that actually mean in practice? Well, we're not talking about your routine doctor's visit here. Part A is for things like inpatient hospital stays, some short-term care and a skilled nursing facility to help you recover, and hospice care.
So, if Part A is the hospital insurance, the other half of that foundation is Part B. And this is your medical insurance. If Part A is for the big, unexpected things, Part B is for all your everyday, outpatient medical needs.
And here's a look at what that covers. We're talking about all the stuff you do when you're not in a hospital. You know, your regular doctor visits, seeing specialists, preventive care like flu shots and screenings, lab tests, and even things like wheelchairs. So, now you've got your foundation, parts A and B, you're all set, right? Well, not quite. This is actually where you hit your first huge fork in the road. You've arrived at a major crossroads and you have to make a big decision. And this is the fundamental question you have to ask yourself. How do I want to get the rest of my coverage? Do you want to stick with the traditional government program and add to it? Or do you want to get your benefits through a private all-in-one plan? This one decision really defines your whole experience.
So here are the two paths laid out. Path 1 means you stick with original Medicare from the government and you add the other pieces you need. Path 2 is where you go with a Medicare Advantage plan, which is a private insurance plan that bundles everything together for you.
Let's dig into Path 1 first. I like to call this the build-your-own approach. This path is really for people who want the most flexibility to see any doctor who accepts Medicare and want to customize their coverage.
So here's how you build it. You start with that base of original Medicare, parts A and B. Then, you add a separate private plan for your prescription drugs. That's Part D. And then, as a third piece, a lot of people add what's called a Medigap plan to help cover the out-of-pocket costs. Okay, but what if building your own plan sounds like a bit much? Well, that brings us to Path 2. This is the all-in-one bundle. This is going to feel a lot more like the kind of insurance you might be used to from an employer. This is what's known as Medicare Advantage, or sometimes Part C. Just think of it as a one-stop shop. A private insurance company takes parts A and B, bundles them with prescription drug coverage, and rolls it all into one plan. And these are incredibly popular now. More than half of everyone on Medicare has one. But, you know, there's a trade-off. The pros? You get a hard cap on your out-of-pocket costs for the year, and they often throw in great extra benefits for things like dental, vision, and hearing. The cons? You generally have to stick to a network of doctors, and you might need to get approval from the plan before you can get certain services. It really comes down to convenience versus flexibility. Now, listen up, because this might be the most important part. No matter which path you are leaning towards, there is one thing you absolutely cannot ignore: the deadlines. And this isn't just about paperwork. Messing this up can cost you real money for a long, long time. So you're going to want to circle this on your calendar. You get a 7-month window to sign up when you first become eligible. It starts 3 months before your 65th birthday month, includes your birthday month, and runs for 3 months after. This is your golden ticket, your one shot to enroll without any penalties. And here's why that window is so critical. If you miss it and you don't have other qualifying coverage, you could face a late enrollment penalty for Part B. And this isn't a one-time thing.
It's a penalty that gets added to your monthly premium for the rest of your life. Seriously.
So when you zoom out, you can see just how important these choices are. And with the number of people on Medicare expected to jump from 65 million to 80 million in the coming years, well, the path each person chooses is going to have a massive ripple effect across our entire healthcare system. It really makes you wonder, how will these choices shape the future of healthcare in America?